Hello everyone, and thank you for the opportunity to speak with you today. My name is Emma Smith, and I am here representing the Disability, Rehabilitation, and Assistive Technology team, a part of the Health Workforce and Service Delivery Unit in the Division of Country Health Policies and Systems at the WHO Regional Office for Europe. On behalf of my colleagues at WHO Euro, I would like to express my gratitude for inviting us to participate in today's event. Our role at the WHO Regional Office for Europe is to support countries in our region to meet citizens' needs and expectations about health, aligned to the 2030 Agenda for Sustainable Development and the Global Action Plan for Healthy Lives and Well-Being for All. Today, in line with the theme of this year's World Hearing Day event of Changing Mindsets, Making Ear and Hearing Care a Reality for All, I'd like to talk about a topic which we believe is fundamental to that mission, ensuring our health systems are inclusive and serve the needs of everyone, including those who are deaf or hard of hearing. I'd like to start with an acknowledgement that access to health is a human right. It is enshrined in Article 25 of the Universal Declaration of Human Rights and affirmed once again in the UN Convention on the Rights of Persons with Disabilities. Health is also acknowledged to be critical to building a more just and sustainable world. Goal 3 of the Sustainable Development Goals, to ensure healthy lives and promote well-being for all, at all ages, reminds us that significant inequities still exist when it comes to accessing even the most basic of health services. Unfortunately, the research tells us that even within those countries where there is greater access to health services, people who are deaf or hard of hearing are not able to access those services equitably. In the WHO European region, it is estimated that 20% of people have some degree of hearing loss. That represents 1 in every 5 individuals, or over 190 million people. Of those, approximately 750,000 use sign languages to communicate in one of 31 national or international languages, and an estimated third use hearing aids. The population of people who are deaf or hard of hearing is diverse as the region itself. This diversity must be acknowledged when we are discussing access to healthcare. Despite our acknowledgement of health as a human right and the high prevalence of hearing loss, access to health care and health systems remains a challenge for people who are deaf or hard of hearing. For example, a study in Greece showed that 93% of deaf people and 77.8% of people who are hard of hearing had difficulties navigating the healthcare system. This resulted in barriers in access to health services and significant unmet needs. Some of the challenges included difficulty booking appointments and limitations in the time available from interpreters to support healthcare access. A lack of understanding of the needs of people who are deaf and hard of hearing among healthcare professionals contributes to these challenges. Furthermore, poor levels of knowledge among healthcare providers in how to communicate effectively with people who are deaf or hard of hearing results in inadequate access to healthcare information and lower levels of health literacy. Accessing health information requires the information to be presented in a way which is understandable, both in language and in style, and relies on effective communication and methods from healthcare providers and policymakers. Health information is frequently provided in spoken or written form, which may not be accessible to all who need the information. Interpretation may not always be available when it is needed for those who communicate using sign languages, and critical health information may be missed or misunderstood. Difficulty accessing health information also contributes to low levels of health literacy. Health literacy is defined as having the required knowledge and abilities to understand, evaluate, and use health information. Health literacy is inextricably linked to communication with health providers. Health providers are responsible for providing the information which contributes to someone's health literacy and understanding. However, they must also be aware of an individual's existing knowledge, understanding, and awareness in order to provide the right information in the right way. The consequences of low health literacy are clear. Those with lower levels of health literacy receive less appropriate and less adequate healthcare service. They are more likely to visit emergency departments and have increased lengths of hospital stays. Low health literacy also results in increased difficulty using medical advice, lower likelihood of following treatment plans, and may result in higher rates of preventable conditions and higher mortality. A review on barriers and facilitators of health literacy among deaf individuals in 2017 found low levels of health literacy among people who are deaf and hard of hearing, resulting from poor access to health information due to communication and language barriers. These communication barriers and limited access to inclusive health information contribute to poorer health. The very real impact of challenges accessing inclusive healthcare is poorer health outcomes among the deaf and hard of hearing population. For example, a study of nearly 300 deaf people in the United Kingdom was published in 2015, which showed a greater prevalence of obesity, hypertension, and depression than was found in the hearing population. Furthermore, the study found lower levels of self-reported cardiovascular disease and lower treatment rates for cardiovascular disease than the hearing population. 3/4 of those with blood sugar at pre-diabetic levels were unaware. It is clear there is a gap in access to health which must be addressed. Addressing these challenges requires commitment to inclusive health systems. The WHO European Framework for Action to Achieve the Highest Attainable Standard of Health for Persons with Disabilities 2022 to 2030 is a roadmap to develop and deliver inclusive health systems. This requires consideration of inclusive practices at all levels, from policy to practice, to ensure all receive access equitably to healthcare services. Achieving inclusion in health systems, specifically ensuring the inclusion of people who are deaf and hard of hearing, requires us to change the way we work and the way our systems operate. We need to change mindsets across all areas of our health systems, not only at the point of healthcare delivery, but also in our policies and systems, which require careful evaluation to ensure they are inclusive and do not present barriers to access to healthcare. This also requires a substantial investment in capacity building in leadership and governance. To that end, a leadership and governance toolkit is currently being developed to support the European Framework for Action and promote inclusion in health systems at all levels. The toolkit will address issues in transparency and accountability, finance and budgeting, representation, health laws and policies, accessibility, and health workforce capacity building, with the aim to support leaders and policymakers in creating more inclusive systems as a whole. Achieving inclusion in health systems, specifically ensuring the inclusion of people who are deaf and hard of hearing, also requires substantial investment in capacity building of the health and social care workforce. This is not just critical for the primary care workforce, but extends to all those within the health system at all levels. There is a need for greater awareness and understanding of culturally relevant communication methods and choices, and of the specific communication needs of the deaf and hard of hearing community. This also requires a substantial investment in capacity building for those in leadership and governance roles. When considering leadership and governance, we can't help but think about the impact of policies on access to health systems. That our policies may be facilitators to access or may impose barriers on access. It is therefore critical that when we are developing or revising policies for health systems, that we ensure representation in the conversation which contribute to those changes. Representation cannot only be in name. Representation must be meaningful, ensuring we are including a range of perspectives from those who are directly impacted by policy changes. It is critical that people who are deaf and hard of hearing are part of those conversations. Among the other recommendations of the Framework for Action, accessibility of information is also highlighted. To truly achieve inclusive health systems, information must be accessible to all service users across all potential interfaces within the health system. This extends far beyond the interaction with a healthcare provider and includes all interactions a person may have with the health system, from the experience accessing information about the service to booking and navigating services. It includes how information is communicated throughout the process in ways which are linguistically and culturally relevant for all members of a society, including those who use sign language or assistive technologies to support communication. Importantly, this must encompass access to information and adequate communication in the context of health emergencies. Technology also has a role to play in developing and ensuring inclusive health systems. While we have a wealth of technology currently at our disposal, including video relay services and hearing assistive technologies for those who choose to use them, we will also see a role for emerging technologies that use artificial intelligence to facilitate communication in health settings. As digital and assistive technologies advance to support inclusion, it will be important that we not lose sight of whether access to these technologies is equitable. Ultimately, inclusive health systems are an essential component of universal health coverage. Without ensuring that all within our society can be served by our health systems equitably, we cannot achieve universality of coverage. Achieving universal and inclusive health systems requires sustained contribution by all of us, working together to change mindsets to ensure access to health for all. Once again, thank you for the opportunity to speak with all of you today. I look forward to fruitful conversations and debates about changing mindsets and making ear and hearing care a reality for all.